North Carolina state legislature is now considering revisions to a bill that would ban wearing face masks in public. Supporters of the bill say it's intended to address an increase in protesters covering their faces to avoid being identified by law enforcement. But critics worry about its potential impact on public health. The bill passed the state Senate last week, but the House paused it yesterday to consider revisions. Start Here host and managing editor Brad Mielke joins me now to break it all down. Brad, this law has been on the books in North Carolina since the 50s, and it was first intended to address the Ku Klux Klan wearing hoods in public. Then COVID happened, and they changed the restrictions to allow people to wear masks for public health. So where does this all stand now? Yeah,
that's right. The idea, of course, was you don't want masked people terrorizing you. Of course, then you had a public health crisis, and you had lots of people who needed masks to literally protect themselves. The thing that's changed now in the last couple of years is a couple of things. One is a crime issue, right, where you've got people who are wearing masks while they're committing even petty crimes like shoplifting or something. Masks are more socially acceptable, and all of a sudden those law enforcement said, oh, now they're being sort of used as a tool here. Now, would those people still be committing crimes without face masks? Possibly, but whatever. Then you had the issue, like you said, of these protesters. And you had lots of protesters on college campus and these really incendiary protests. And people would get so mad at them being there that they would start taking their pictures, spreading them around the internet. People would start getting harassing calls. At one point, you had cars running around with showing images of protesters being like, don't hire this person. And so a lot of these students felt the need to protect their identities. And so they would start wearing masks exclusively with the intention of disguising themselves, with concealing their identities. That is what crossed a line to a lot of law enforcement folks in North Carolina and to Republican senators. They decided to remove this public health exemption that had existed, saying now essentially that it would be illegal, not just to wear a mask while committing a crime, but to wear a mask on the street at all. That is where the House has now said they've gone too far.
Now, you spoke with Sydney Batch, a Democrat in the state Senate there. She's also a cancer survivor. What did she have to say on this issue, and what does she say she's hearing from her constituents?
Well, and what's significant about her being a cancer survivor, of course, is that she, like a lot of cancer patients, have gone on immunosuppressants, right? These drugs that basically make your immune system less able to fight diseases. And so she talked about how she's needed to wear a mask in public. Her family members have needed to wear masks around her and around family members, basically to insulate her from disease. And this happens all the time, whether it's organ transplant recipients or people with immunocompromised statuses. And so she says that while she understands the public safety concerns, the public health concern is still much too great to tell people they're literally not allowed to use one of the best tools they've got at their disposal to protect themselves. And so she said that this is a step way too far, and that's why she sort of tried to battle this in the Senate. And now she's relieved to sort of see members of the House backing this down because, frankly, Republicans have a supermajority. Even if the Democratic governor there had vetoed this bill, they could have potentially overridden this. It doesn't look like that'll happen right now.
So what about bad actors who just want to cover their face so that they could commit crimes anonymously? Is she addressing that?
Yeah, I mean, she did actually say that she was like, I'm concerned about this too. Like, she is not somebody who's like, privacy at all costs. She actually said that people should be, made in some cases to lower their masks to be identified when maybe they're going into a store or something, but that the idea that you couldn't wear masks on a public street in broad daylight, and frankly that, in the bill itself, I should say, it says you cannot wear a mask in public with the sole intent of disguising yourself. So kind of in the law.
So maybe like an N95 or KN95, but not a ski mask.
No, it specifically says
like
even for medical masks, you wouldn't be allowed, but it says the intent is key. Well, how do you judge the intent
of
what someone's doing? So would a cop be able to go up to somebody and say, hey, are you wearing that for medical purposes?
Yeah. And they say it's at the cop's discretion, right? Who they question.
It's at the cop's discretion. And so then who does is the cop allowed to say, I don't believe you? And this is what Sydney Batch says, who, by the way, is African-American, says this becomes also a bit of a race issue, right? You've got African-Americans and black and brown folks in North Carolina who have actually died at COVID at worse rates than whites. So you have a lot of people who are still masking in public, still being very cautious. And then you've got it up to the discretion of police officers to judge who looks like they might be a criminal and who's not, who's looking out for their health and who's just doing this to conceal their identity. Where do you draw the line? And that's where Sydney Batch and others say this has gone way too far.
All right, we'll be watching that one. Brad Mielke, thank you.
Thank you.